Hello, welcome to the University of Tennessee at Chattanooga's Introduction to Pre-Health at UTC. We're going to go over what you need to know starting out as a pre-health student at the University of Tennessee. I'm Teresa Blackman. I'm the Pre-Health Professions Advisor.
And I'm Donna Cooper. I'm the Associate Director in the Center for Career and Leadership Development.
So first, we're going to talk about pre-health services. We have a bunch of different options for you as you get started on your journey. The first is one-on-one virtual pre-health advising meetings. For currently enrolled students, you can schedule those through Navigate. For those of you that are not currently enrolled, such as alumni or prospective students, please feel free to email me to set up an advising appointment. We also have several workshop series that are completely virtual for the fall 2020 semester. The first is Periodic Ponderings, which you are viewing the first of that series. And we also have content within that workshop series addressing application cycle preparation, program showcases where we'll review the requirements for things such as medical school, dental school, occupational and physical therapy. We also have human interest pieces, things such as biomechatronics and oddities in medical history. One of the other big components of the Periodic Pondering series is our partnership with Donna's office, Career Services. We'll review resume, personal statement preparation, information on application cycle, and interview preparation. We also have a virtual campus visit series, and for the fall 2020, we have 12 programs that are going to be visiting us virtually. You can register for either one of these series through the pre-health advising website, which is linked to this presentation under events. The pre-health advising website is also a huge resource with tons of information on applications, extracurricular opportunities, which is a huge question right now with the pandemic, information on test prep, study abroad, and guide maps. And guide maps are detailed guides on different programs and the requirements you need to have coming from UTC. So this is how you would schedule an appointment through Navigate. Again, you have to be a currently enrolled undergraduate student to do so. If you are not currently enrolled undergraduate student, you do need to reach out to me to set up that advising appointment.
So like Teresa said, Career Services is in conjunction with the services offered through pre-health advising, and the different things that we can do kind of take you from beginning to end. We can assist with career counseling and workshops. If you're trying to figure out how do you develop a strategy for the places you want to apply to, if you need help with your professional documents, if you want us to look at what you've already put together, we prefer to have a draft. It's a whole lot shorter conversation about the dynamics of the font as compared to the strategy of how to use it. We can conduct mock interviews. We also have in our center the leadership programming, which helps if you're getting a lot of feedback from schools and professions that they want to know about your leadership experience. The mock lead program can take you through a workshop on that lasts an entire semester. We have leadership coaching and then additional resources to help you. One of those resources is Handshake, which is our on-campus listing for part-time, full-time jobs, internships, and co-ops. We've got a link to the Handshake account. This is where you can set up a profile and you can designate who you want to hear from. Do you want to hear from hospitals? Do you want to hear from different agencies? And then you will get an email when those people post. Check it out.
And a quick note about Handshake. Pre-pandemic, we had planned on working with Handshake to list a lot of shadowing and internship experiences in the local Chattanooga area with hospitals and clinicians. That's been put on pause due to the pandemic, but as soon as we are able to secure those shadowing opportunities, the intention is for us to list them here. So it's going to be really important that you have your Handshake account and you're familiar with how to use it. You've got all your profiling set up so that when we start listing those specific healthcare opportunities, you'll be able to take advantage of them.
And when you do your profile, make sure that you click the button to make it public, or else you're just talking to yourself.
So we touched on this a little bit, our pre-health events, the periodic pondering series, and the virtual campus visits. One event that we didn't touch on is the Mox Move Forward, a discussion and application on diversity in healthcare. This is a 6-part series being offered throughout the fall 2020 semester, reviewing topics in diversity in healthcare. We're going to look at historical events, we're going to look at current events, and the intention is to inspire our students, faculty, and staff to move forward with changes in healthcare. This semester, we are focusing specifically on the experience of African Americans in the healthcare system, both as patients and practitioners. So we're going to switch gears just slightly, and now we're going to talk about some things that you can do to start strong. So the first thing is you want to be sure you know what professions are open to you. A lot of folks come in wanting to work in healthcare, but they're not really sure what, or they don't know what options are available to them. This is the list of all healthcare positions that are open to UTC students. Now, these careers require a wide range of post-undergraduate education, some only a certificate that maybe will last 6 months to a year, others it's professional school. And so that's why Donna and her office are a huge, huge player in helping you move forward in these careers, because you will need a really well put together resume, you will need really good documents to move forward in any of these careers. So any of these careers can be pursued with a bunch of different majors, and we'll talk more about that in a second. But there are some commonalities in that you have to have a competitive GPA. You have to have letters of recommendation that really highlight the whole person. You have to have those good experiences outside the classroom, the shadowing, research, volunteerism, leadership, to really showcase what a well-rounded individual you are. And of course, you have to be able to communicate all of that information to those professional programs in a way that makes them sit up and listen. And it's also important to know that you have to apply to a good number of these programs 18 months before you plan to start. So if your intention is to start on one of these programs the August after you graduate college, then you need to backtrack 18 months, and that's when you actually need to be submitting your application. So a lot of people don't realize they don't have as much time as they thought. And again, that's why it's so vital to connect with Donna and I to work on your materials, work on your application throughout the entire time you're at UTC, not just right before you want to apply. And to give you a reference, this is that list I showed you previously. The careers that are in the boxes, those are the careers that require 18 months prior to you wanting to start for you to apply. And that's the most popular careers that most everybody is interested in. So gotta make sure your timing is on point. One of the other things you have to make sure is on point are your GPAs. And there are 3 GPAs that you really need to be thinking about when you're looking at any sort of professional program or graduate school. And that's a cumulative GPA, a science GPA, and a competitive GPA. So the difference between these 3 is the cumulative GPA is everything. So that's going to be all the college coursework you have ever completed ever since you were a tiny, tiny little baby. Your science GPA is all of your science courses. Traditionally, it's your math, biology, chemistry, and physics courses. Some programs do specifically say they only factor in prerequisites into the science GPA. So unless the program that you're looking at specifically says that, assume that it's all math, all chemistry, all biology, and all physics coursework. The competitive GPA is the one that folks don't think about, and that is the average GPA of those that have actually gotten into the program. And people will mistake this for the minimum GPA, which we see advertised on the admissions websites. And so a lot of people that don't get into programs are really confused. They're like, I don't understand. I had a 3.2 and the minimum GPA was only 3.0. Well, if they had looked at the competitive GPA, it would have been 3.6, 3.7. And that's just to show that a lot of people don't look at that. And there are a lot more people that have a much higher GPA than they did. So that's why they didn't get in. And it's also important to note, they don't do repeated grades. Most professional programs don't factor in repeated grades. So even though UTC may have erased your first attempt and counted your second attempt, or if you've gotten academic forgiveness, they're not factoring in all those grades. professional programs well. So if you have any concern about what your GPA actually is, definitely connect with me. And AP and CLEP is often not accepted for science coursework. So again, pay attention to those program requirements and reach out if you have questions. We're going to move over to talking about degrees, like we said we would, because you don't have to be a science major to go into healthcare. I know, it's shocking. Most majors at UTC can help you get into a professional program. They can accommodate those prerequisite courses that you need. A lot of the social science majors and HHP, or Health and Human Performance, they have a lot of general electives. And so general electives are just college level credit. If UTC gets credit for it, it can be considered a general elective if your degree has space for it. So a lot of folks will choose these majors because there's a lot of open space. They can take those specific science classes they need. Humanities majors such as history and political science, they have a decent amount of general electives. They also have the option to minor in things. So between those two situations, you can get all of your prerequisites completed. Because the important thing is you want to be excited about your major. You're going to do well if you're excited. You want to pick something you're good at. People make the common mistake of, oh, well, I have to be this major because that's going to be most competitive. Or I heard from a friend who heard from someone. There's always someone. Listen, if someone says, oh, I met someone and they're familiar with this, just don't listen to it. There's always someone out there that knows something. You want to check your sources because most of the time those someones don't know what they're talking about. But there is no secret major that will make you most competitive. There's no trick to get people to think you're most competitive. The trick is pick the major that's the best fit for you.
And also too, you'll have additional programming through this series. One of the things we'll talk about is the letter of interest. If you're not interested in that degree, if you don't have a story about how you came to choose that specific program or that specific school, you're gonna lose points in the competitiveness too. So that's why we would like to see some passion, see some enthusiasm when you're presenting all this.
Exactly. So these are the only professions on that list that actually require a science degree. So we're not just selling you a bill of goods. We're pretty accurate in the fact that these are the only professions you have to have a science degree for. These are the professions that just require some science coursework, but they don't require a specific science degree or any degree really. And you can see that's the most commonly pursued courses or professions. And these are professions that just require an undergraduate degree. So if you're not feeling the sciences, if you get in and you just say, this really isn't my cup of tea, then there are healthcare professions that you can pursue that are not super science heavy. And so that's why I encourage you, talk to me, talk to Donna, reach out to those resources and talk with folks about your career objectives and what you want to do. And let us help you find a degree and find a profession where you will be the most successful in. And just a quick note for forensics, you can pursue forensics at UTC. I know it wasn't on the list, and that's because you have to complete a professional program before you go into most forensic fields. For instance, odontology is a forensic dentist. You have to go to dental school before you can go do the forensic part. So most of these professional programs, you do several years of residencies where you study under that field, and so you would just do your residency in a forensic focused situation instead of a hospital or a clinic. And most forensics programs are pretty chemistry extensive. I know we said you don't have to have a specific major, but if you're going to go the forensics route, you need to be really comfortable with chemistry because there's going to be a lot of that, and that also means a lot of math.
Another guide that will help you with this whole process is the career guide out of the Center for Career and Leadership Development. In that guide, you can find links to the different resources on campus, such as the Focus 2. You may know that you want to go into the medical field, but you're not quite sure what areas of it. That'll help. What can I do with this major? is also on our website, and the Labor Department statistics. In the guide, you'll find tips for developing professional habits, strategies, how to search for an internship. You'll find the stronger words to use on a resume. Instead of saying you helped with, you can say you assisted. Kind of sounds like somebody in surgery. There is a sample resume that will help you get started if you're having a difficult time with even how to start. I would not call that the final resume. You really need to give that to me, give that to Teresa. Let us look at it, because it's not our firstborn child, and we will pick up on things that maybe you didn't get, like instead of served, you said severed. So things like that we want to help with. We want to be there with you to say, maybe you could word this a little more strongly. And the link to the guide is going to be on this slide.
So switching gears again, we switch a lot of gears. We want to talk about some ways for you to be successful outside the classroom and some things to think about, not only in general, but during this rather unusual season we seem to all be living in. And the first is social media. So now more than ever, we are using social media to connect with people, since we can't be in the same room as everyone. And when we can, we have to stay very far away and wear masks. So social media is becoming more and more of an outlet for folks to interface and meet with each other. And it's also becoming a place that more professions and more professional programs are looking at to really see the real you. So you want to review your social media presence. And we want to be very clear. We are not telling you what you should or should not say on social media. We are not advocating any specific belief or idea. We are just trying to make you aware of how your presence on social media can be interpreted by employers and by graduate admissions folks, and allow you to make the decision of how you want to be portrayed. Because the last thing we want is for you to be wonderfully qualified and not realize the role that your social media could play in your application review and it not go the way you want. So just disclaimer. But you do want to review your presence. What does it say about you? What are people going to get the impression of you about? And is that something you're okay with? Please don't delete everything. We are not advocating that, because that is telling too. I mean, especially in this day and age, everybody has at least something: Facebook account, Instagram, TikTok. We all have multiple things. And so if you are completely radio silence, people are going to kind of wonder, well,
What got deleted?
yeah. What happened? And increasingly, admissions officers are reviewing social media to learn more about you. They want to see what your opinions and your biases are, what your social behaviors and your judgments are. And this can be a good thing. This can be a bad thing. This can be a neutral thing. But they are doing it. So you want to make sure that you are portraying yourself how you want to be portrayed on social media. And that also, that is a big. You also want to be careful who you're friends with, who's allowed to tag you in pictures. Because if you're very careful about how your social media presence is handled, but then you have your friend that is posting all the things and tagging you on all the stuff, it doesn't necessarily matter if that was you that posted it. Those admissions folks are still going to see it. Do you want them to see it? And schools are reviewing social media to see how you're complying with the pandemic. If you're wanting to be a doctor and you're talking about how you want to do absolutely everything you can to help people, but then you're posting pictures of yourself not complying to social distancing and mask guidelines and talking about how it's silly or, whatever, and, kind of putting other folks at risk because you're not doing what medical professionals are recommending in relation to the pandemic, questions will be asked. Well, does this person really want to be a health physician? Or they're saying one thing and doing another. What else are they, having that double speak about? And you can do this really easy. Search your name. Know what's out there. Schools are going to do that. Any thoughts, Donna, on the social media?
I think we've done our part in trying to make it conscious. We're not trying to tell you how to do it or not to do it, but be conscious of how it could come across. And once you go to that school, once you're working for that hospital, you are a representative. And once you're a representative, then definitely your status can change in a second based on whatever is out there. So just be conscious of how you're marketing yourself.
We're going to talk about some navigating the new world with work and study.
Okay, so one of the things that we've talked about is what have you done during COVID? During the time that you were isolated at home, during the time that you were trying to think of things to do, did you reach out? Did you offer technology skills? Did you offer, for example, we've got on here, did you receive training and participate as a volunteer in contact tracing? That is relevant on your resume. It doesn't have to mean you got paid for it. We had a student who was also a Spanish major, and they reached out to organizations to see if they needed help with translating information so that the Hispanic population would know where to go to be tested. So have you done anything like that? And it's ongoing, so what are you doing? Zoom meetings, we'd like for you to have a clean background, even if you can't set up a virtual background. A clean background will tell them that you're organized, whereas if you're saying you're organized and you've got last week's laundry piled up on the couch behind you, again, it might change what they think. So we have some tips for you as far as the professional live chats. We would encourage you to be sitting up, not to be laying down in a car or on a couch. We would encourage you, because you're going to be a little more casual in what you're putting in the chats, we would also encourage you not to talk in all caps. Just like in other social media areas, all caps kind of looks like you're yelling. And there's a typing indicator so that when you are typing something in a chat, the person that you're chatting with will see that you're in the process of making a comment rather than wonder, did they leave the room? When you have a virtual interview, we usually would tell folks face to face, get there 15 minutes early, 15 to 30 minutes early. If you go into a chat ahead of time, you could be interrupting the interview or the conversation that's going on at the time. And I've had that happen. So fortunately, for once, I was not the one who did it. It happened to me. When you have your virtual interview, think about what's behind you. Is it a window? Are the blinds open? Is the lighting changing? Is it going to be difficult for that person to see you because the lighting is not appropriate? We would like for you to dress in total professional attire as if it was a face-to-face interview. We've all heard oh, you only have to dress from the waist up. You can wear your pajamas below the waist. The only problem is if you drop a paper that you wanted to be sure to share with them and you stand up, it's going to show. So again, just be professional. It's going to be less than an hour. You can do it.
So we kind of addressed this with the PJs. Wear a shirt, please. We've both been recipients of meetings where folks have been shirtless, and it's just kind of awkward. And this goes for online classes and workshops as well. You never know who is going to be in that class that you may later need to get a recommendation from. If you're constantly the shirtless guy that goes to class in your biology class, and then 2 years later, you want to ask that biology professor for a recommendation, he just remembers you were a shirtless guy. You probably don't want to tell the med schools that. Or maybe you do, I don't know. But I would vote not. Virtual campus visits, we've got a lot of them going on. A lot of professional schools, a lot of professional programs are, defaulting to these virtual visits for fall and even spring due to the pandemic. So you want to treat them like interviews, because if you do something colossally strange or different or memorable, that's what you'll be remembered for, not your wonderfully qualified application. Pets, put them in another room. It's all fun to have, the cat walk across the screen, but it's distracting, and it just, you don't want to distract your professors, your faculty, advisors, your whomever you're talking to. Mute and turn your camera off if you need to get up or move around. A couple of reasons, just again, for distractions. If you're walking around, the movement's going to distract other people that might be in that meeting or workshop with you. Also, the change in acoustics can reverberate and split people's eardrums. But a thing people won't think about is motion sickness. A lot of people get motion sick. And so the last thing you want is to make one of your classmates, professors, or even, the person who's interviewing you feel nauseous and ask you, please stop, I'm gonna throw up. So keep it still. If you need to move around, mute and turn your camera off. Ideally, you want to do all of your interviewing, your classroom attendance, all of that on a laptop. But if you are using a tablet or a mobile device, try and secure it so it's not, jumbling around. And please do not carry your device into the bathroom. We know, we are aware of what you are doing, and it's awkward. So leave your device in a different room, or mute and turn off the camera before you go to the bathroom, but we prefer the first one. And this segues into being mindful of your location. Avoid cars, especially while you're driving. The car might be the only place you can go that's quiet, where you won't be interrupted, and that's fine. Just try and sit up and make it look as professional as possible, but don't zoom into an interview or a workshop or a class while you are driving. Also try and avoid coffee shops and restaurants. I know we don't remember a time when those things were crowded, but they will be again. And so a lot of clanking and loud noises can be distracting. It can be hard for you to hear. It can be hard for them to hear you. So just quiet, uninterrupted location is best. And so if you want to learn more, we have listed out some of our events. So unfortunately, our PT and OT program has already happened, but the med school showcase, the pharmacy showcase, those are happening. Our physician's assistant and dental programs are also coming up. We've got research, application preparation, and resume and interview workshops. So definitely, if you are a currently enrolled student, faculty, staff, head on to the Pre-Health Advising webpage and sign up for those events. So if that concludes our presentation, please reach out to either of us if you have questions. All of the links that we've referred to through this presentation will be in the comments below for you to review. And we hope you have a lovely and safe rest of your day.
And we look forward to seeing you at other events.